have Dr. Shukin, who's the surgeon who does the surgeries. I'll let him introduce himself, his experience, and then we'll answer your questions. We'll go straight right to answering your questions. Okay, so introduce yourself.
Okay. My name you already had. I'm a surgeon for the last maybe 40 years. The last more than 10 years I'm more passionate in doing laparoscopic surgery and mainly bariatric surgery because it became very safe. It became not lengthy as it used to be before, and it is really one of those which are mainly helping people, those who are obese, to lose the weight. So, well, I'm Ukrainian by birth, I'm Kenyan by many years, and yeah, that is our place, and we are trying to help people here in Kenya to become healthier by losing the weight and all that what is related to the weight.
Okay, good. So now we heard from the wife that he has also gone through a weight loss surgery and he struggled with his weight for a while. And you can see he's maintained it. How many years has it been?
When I was operated, about 4 years ago.
Wow. And you've maintained it?
Yes.
Okay, okay. So another thing which you guys were asking the doctor about is the different kind of bariatric surgeries that they offer. Like I mentioned, I did a bypass, but there are many, many others, so the doctor can tell you what they offer to the different surgeries.
Well, generally bariatric surgery is a minimally invasive surgery, and we are doing, which is not really the surgery, although it is developing more and more. It is called endoscopical balloon. So we are doing endoscopy. We are checking the size of the stomach. We put the balloon there. It's not related to any cut, although the patient has to go through the general surgery, the anesthesia, and it can stay. The disadvantage is that it can stay only for 1 year.
That's the balloon?
Yes. And then we have to remove it back. Now, because balloon is the device which is in the stomach, and the body and the stomach can get used to it, still the patients have to go through the different style of life, style of eating, because they have to eat a certain portions, and whatever the quality of the food is the best food, then they can lose. Because I had quite a number of people, those ones who, what is the general population feeling? Doctor had done it, I went through this procedure, now I'm going to become different. Which is not the case with the chronic cases, especially with NCD, with the obesity in general, because I have done my part, put in the balloon, but the patient has to be the part of the game. The patient has to remember about the chronic disease, the obesity, and all the time follow the advices, then it will work. So that is the balloon. Then more serious laparoscopic surgeries. The world started with the gastric band, which is still available, but it is very less popular at the moment.
Yes, I think I've not had in a while someone doing a gastric band.
Yeah, there are still people, those ones who are saying, I'm ready to do the bariatric surgery, but I don't want any part of my body to be cut or to be removed.
Okay.
So then we can put a band, although it is required more frequent following up with the doctor. That is required more strict to be in terms of what they're eating, to prevent any kind of complication, because if they're eating more, then there is something which is called slippage of the band, or there is something which is called the wound because of the pressure of the band big and so on. And then, of course, the consequences of the side effects is very serious, and then you have to deal with that. Yeah, so that is the band. It can stay. Also, it has the lifespan. With the experience of the centers where I had a training for the band insertion, it is about 15 years they can keep the band.
Okay.
But after that, they have to remove it.
Okay.
Then, recently, but a decade ago, it was introduced gastric sleeve resection. It's not something that it is just invented. We used to do this kind of operations, open surgeries, for whatever the reason with the stomach problem, and then it was found that the patient is losing the weight. So now it is done laparoscopically, gastric sleeve resection, which is on the picture there. Well, that one is just a restrictive operation when you are reducing the size of the stomach and the patient cannot eat much. But you know, those ones which are not following the need post-operatively, they are slowly increasing the amount every day, and then they can come to square one again.
Yes, it's possible to reverse.
Yes, and after that, of course, the patient has a problem being operated and stop losing or starting gaining the weight. So that is gastric sleeve resection. Then the bypass you mentioned about, it is a restrictive operation because we are tailoring from the stomach a very small pouch, which is actually accumulating the food, and then it goes directly to the gut, which is bypassing quite a part of the intestine from the digestive process, and that one miraculously works on those who are having diabetes, who are having blood pressure high, and the people are losing the weight. And it is not that pouch will become bigger if people are eating extra, but problem is if the people are eating extra, it will be more digested in the intestine, and if you are not controlling the amount of calories which you are eating, in 3 years' time, even people after bypass starting gaining weight. So bariatric surgery is very good, and we have to do it, but the patient has to understand
they have a part to
its own part which they are playing to maintain it. Now, there's a variations of the bypass. It is a single anastomosis bypass, or they are calling it mini bypass.
That's another question I did too. What's the difference between a mini gastric bypass and a full gastric bypass?
Full gastric bypass, it is a two anastomosis, or two joining. We are cutting the gut. One part goes to the pouch of the stomach. One part is joined to another part of the previous. So that is two anastomosis. Now, mini gastric bypass, it is a single anastomosis. We are selecting the part of the intestine which is to be bypassed, and then that part we are joining to the pouch which we are again tailoring from the stomach. So it's one anastomosis. There are advantages and disadvantages. If it is individual reaction or something, it can be the reflux of the bile to the stomach, which can cause development of the gastritis or the ulcers or whatever. So every operation is good, but has also some cons
side
as well.
effects,
Yeah.
which people have been asking. Like the doctor just mentioned, when he does for you the surgery, he's giving you a tool. You also have to play a part and do the right thing, which is meaning watch your calories, eat healthy, exercise, and that's why psychotherapy is important, because you need to change your mindset and relationship towards food and a healthy lifestyle. Second question was, does the bariatric surgery have any side effect? And you started talking about it. What side effects are there? I know acid reflux.
You see acid reflux. You see, if we are doing the gastric sleeve resection, but the patient has maybe diaphragmatic hernia or has reflux disease, then that person will be suffering after surgery, because the pressure in the stomach becomes bigger after the stomach was operated than it was before. So definitely it will be the effect. Bypass has another side effects. You have to take side effects, consequences in the life. You have to take on a regular basis every day some supplements. If you're not taking them, you can keep yourself to the level that your iron will be dropped down, your protein will be dropped down. So if you're not thinking about it, you may have this this body reaction to this operation. Now, if you're talking about application, which is kind of like a sleeve resection but without cutting the stomach, you may have the situation when the part of the stitches are cut through and their stomach open again. So you have to do the application again. And it is not very popular in the world, because quite a number of operations after the surgery, again surgery. Those ones who are having, despite of anything, and they are not working with the psychological correction of eating behavior, the people can have a poor result even after bypass. They have to go through the purely metabolic surgeries, which are more serious. But those ones, it's a really influence on their metabolic process, and it is duodenal switch and a couple of more operations which are very serious. But it is I would say I would not be very brave to do it here. It is better to do this kind of surgeries in the centers where all the possibilities for that are there and expertise are there, because they are not very common in the world of bariatric surgery. So now complications, they are divided in two groups. One complication is that what is depending on the lack of equipment, lack of experience and so on, I mean from the surgical team. And there's a bigger group of complications which are coming from the patient itself. Because when you are advising the patient, don't take this, take this amount, and the people are, because they have that psychology, of eating, they will start doing it themselves, so let me try. Then they can get busting, they can get leakage, they can get bleeding, they can get several things there which can be the complication. But generally, complication level is like it is laparoscopic appendicectomy, like it is laparoscopic cholecystectomy, so it's a 0.0 something, which is a very low level of complications.
And when you say, people are asking, do you get cut? I said earlier the surgery is it's done laparoscopically. Explain to them what laparoscopy means. Like people think they are being cut and you enter in the stomach.
Yeah, laparoscopic surgery, it means that it's another name is called keyhole surgery. When you're making a really small holes, you're putting instruments there, you're putting your camera there, and you're doing that without cutting. That's why 10 days after surgery, the patient can start doing sit-ups, press-ups, and all those things. They can start doing the exercises, and recovery is faster, pain is less, and so on. Patients are staying in the hospital 1-2 days.
He's even gone ahead and answered the question how long it takes to heal. You've had for yourself. I myself was in hospital for 2 days and then I was out and I kept coming back for my post-op and stuff like that. So it doesn't take a long time to get back to your daily activities.
Yeah, I operated the patient yesterday. Tomorrow I'm going to discharge her home. So
Exactly,
that's how it's going on.
Okay. So another question which people had was, is it risky to do the surgery and then get pregnant later after? Which I let the doctor answer.
Okay, the reason why several obese women are coming here and they are doing the bariatric surgery is just exactly that. Either she is not able to conceive or she is not able to finish up the pregnancy, the term.
Because they are overweight.
Because they are having all this, number one, their visceral fat is affecting in terms of creating their hormones which are not friendly to their pregnancy, and they can cause the diabetes and blood pressure. And number two is just because of the poor blood supply due to the big amount of fat in the body, in the abdominal cavity, the conceiving process is affected, and then she cannot conceive in general. So yeah, the risk is that she will become pregnant and she will deliver. That is the risk.
Another question people were asking is, which I also think I want to know, over time, like the biggest fear for any patient who's going through bariatric surgery, can my stomach stretch back again? Because I've realized what I used to eat 2 years ago, I can eat a bit more now. My stomach can take a bit more.
I mentioned very briefly, let me stress it again. When I'm going for different kind of symposiums or the gathering of the bariatric surgeries, and I can compare our results with the results in the world, our results in many parameters are better than those which are present in the big centers, because we are using psychotherapeutic things, we are using changing of the brain setup, and we are doing that what everywhere in the world the bariatric surgery does. So it means that if you are changing the feeding behavior and your brain is realizing that you are eating to live, not living to eat,
yes,
then you are okay. So if we are talking about the long-term results, when you know this psychotherapeutic part and you know the amount of calories and way of preparation and what the best food in the world, you can eat more, but if you are eating healthy, you will just remain the same amount of calories. When you are not eating healthy, you can take a couple of mandasis and you will just finish up your daily calorie requirements, and then you can be you can be just starving because 2 mandasis is not enough in terms of amount of food you are eating, but you will be gaining weight.
Yes.
So that's why if people are definitely when you are operated, and as I said, even the small pouch after bypass can get bigger, but if you are filling up that pouch with the right food,
then you'll be okay.
Yeah.
Okay. Another question people were asking is, what happens, how do you manage the excess skin? Which I always get asked that question, but I always say it depends on how big you are. Maybe you can clarify on that.
Yeah, it's a very common, not really 100%, but it's a very common. It depends how big you were before you were operated, how stretched your skin was, because the skin has several layers, and the base of the skin is the layer which, if it is kind of torn when the patient is too big, then when the slimming process goes on and the skin starts shrinking, those stretch marks, they might not disappear. That's why, because of those stretch marks, people can have a sagging skin. And it is not 100% that everything will go and it will be just as nice as nice as your skin, for example.
Yes.
Right.
Yes.
But people will have a sagging skin, and then if they want to be nice and not to be ashamed to go in bikini to the beach and so on, they do the plastic surgery. And there's quite a number of plastic surgeons which are doing a very good job, and there is a good techniques of reducing the skin with the minimum kind of scarring on the body, that it will work. Although nowadays they are saying about this aesthetic surgery sort of, and there's several electrical devices which they are advertising that if you are doing frequency to the skin, you are making the skin thicker and kind of shrinking despite of the stretches. I have not seen enough scientific results after that. It is just only their marketing things, and a lot of marketing things comes just to sell your product. So we trust in the evidence-based things. If you have the evidence-based, then we can say, yes, this one is good, let us put it in our arsenal to use it. Yeah.
Okay. Another question which I had also, which is from my own perspective, I'd say when I did my surgery, my biggest side effect was, like you said, my iron levels are low, calcium, so you have to take supplements. But there's something called dumping. I don't know if that's the name doctors call it, or when I have something that is high in sugar or high in fat, I feel dizzy and I go lose, my stool becomes, I have a running stomach. Is that the name, or why does that happen?
Well, it's a medical term. Some patients, they hear that without knowing what is that, because of course they are not medics, so they do not know about it. Dumping syndrome means that you are just, the patient has a reaction to bringing inside the intestine without prior metabolic processes, carbohydrates or sugar or whatever, those ones which are coming back to the, as a process coming to sugar. So it's just a big amount of sugar just in the place where it's not supposed to be immediately. And then when it is absorbed to the bloodstream, the sugar, the final product, or the glucose absorbed to the bloodstream, it kind of very big stress to the pancreas, and then development of the production of insulin. It's a big chain in the metabolic processes which are making people to feel dizzy, to feel
I sweat, I feel
sweating, the fever, weakness, even passing out, all those things there. That is the dumping syndrome. It used to be, we know about it for many years without any bariatric surgery, because it was part of the reaction of the body after the removal of the stomach and making the food going directly to the intestine. So the easy way and the most effective way of dealing with that is not to take the medication, just to avoid that gulping a lot of sugar, carbohydrates immediately to the body, or to avoid it. Some people, they have the reaction like a dumping syndrome to milk, for example. So people are avoiding that, and like this. I mean, it is It is adjustable, it is possibly.
Oh yeah, I just
once you are talking
it.
to the doctor and doctor found it out, then the right advice will be given.
Yeah, for me, I just avoid eating foods that are high in sugar and fat to avoid, and that also helps me control because I don't like feeling that effect. So it helps me control what I'm eating. Another question is, what about gallstones? People who tend to do bariatric surgery tend to get gallstones. I haven't, lucky enough, 5 years later, but is it something that you have to keep checking?
It's not very common, but it is possible, yes. And the gallstones, it's a one part of the problem. It is just because, again, the metabolism is not exactly the way how it should be in the body, which is not operated.
Okay.
So it is possible that the bile is concentrated, and then it is concentrated or more concentrated bile is coming to the gallbladder, where it is concentrated even more, and then it develops the gallstones there. Yes, there's medications which are required preventively on the beginning to be taken to prevent it. If somebody has history of gallbladder disease in the family, it is not really preventable by, or maybe we do not know yet that by using this kind of diet it is preventable there. But yeah, you do not need to go regularly and to start checking your, doing ultrasound, checking your gallbladder. But if there is some symptoms, if there is some pain, yes, you have to be checked. Okay. It is possibility of forming that. The main thing is that we are 98% made out of water, if to make it very simple way. Any alive body, it is 98% of water. That's why we are saying the water is clever. Water is behaving like a clever organism. So if we are taking enough water to let our metabolic processes to go on well, the kidneys are working well, and the toxins are removed. There is no any kind of constipation. People are having regular bowel motion. All those things there. Then the possibility of having some this wrong metabolism is very low.
Okay, good. Another question is, how do you get to choose between which gastric surgery to do? How do I choose between the sleeve, the balloon, the bypass, as a client when I come to you?
As I mentioned previously, if somebody has reflux disease, then very unlikely that we will be doing the gastric sleeve. If the patient is not very strong in his mind, and then I'm putting the balloon for him, very unlikely that the patient will lose and maintain the weight. So all those things are discussed with the patient. Are you really aiming to lose the weight? Are you very disciplined? Are you going to follow the instructions and the rules and regulations? If a person is saying, no, I better go through the surgery because I'm not disciplined in general, it's not my nature to be disciplined. Me too. So in this case, you have to go through surgery. Now, what to choose if the patient is having another comorbid conditions which are related to obesity, like diabetes, high blood pressure, high cholesterol, possibility of having a stroke and so on, then the most effective is the bypass. So if we are having the patient with this kind of comorbidities, we are saying, you see, maybe sleeve can work for you to reduce the weight, but to make sure that you will eliminate your problems when the patient has another problems apart of the obesity, then it's better for you to have a bypass. So it's very individual. It's based on that what we are having an investigation and having done the doctor is still have to be involved to make a diagnosis and then to advise the patient which operation to be done. Very many people are coming there saying, I am coming to discuss the balloon. When we are discussing generally the health condition of the patient, I'm saying, you know, the balloon is not going to work on you for a long time. So you have to be ready. If you are ready to cater for the balloon, and later on you are ready to cater for the bariatric surgery, because sooner or later you will come for it. Yes. So you can do it.
Yes, because you're not disciplined enough.
You can do it. If you have enough money, you can start with the very...
yeah, I did not. So I started what I was sure.
And then to come up to the end of the story, and you can see some some ladies especially, I'm just amazed how ladies can do something for beauty. They are coming with the breast reduction, with the tummy tuck, with the liposuction.
That is even my next question.
With the tummy tuck, with the liposuction, and after that, because it's not working on that what they are having, they are coming for the bariatric surgery. So men does not do that.
Yeah, men are very logical, and that's the question you guys were asking. Can I do a tummy tuck? I said breast augmentation. You have to first lose the weight and reduce your body fat. You have to get to your ideal health weight before you even think of any plastic surgery.
One of the patients I operated this week was the patient who had gone through all those things then.
Before the weight loss?
Yeah.
Then you've wasted a lot of money.
Well,
because
as
after
I'm
weight
saying,
loss,
somebody has enough money to spend, so why not? Then the patient went, when discussed it, it was a couple of years ago, I said that you don't have to have a bariatric surgery done. No, let me try balloon. Okay, so I put the balloon. 1 year later, I removed the balloon. 2 years later, she's calling and she's saying, I started gaining weight, now I'm ready for surgery. So I've done the surgery. Because the evidence-based statistics saying that the most effective currently, we don't know what will happen after 10 years,
Yes.
20 years, maybe something new will be developed and discovered and whatever. Currently, the most effective way is bariatric surgery. And we can say in our center that most effective way, even more effective than bariatric surgery, if the bariatric surgery is combined with the work of psychotherapy, changing the lifestyle of eating.
And that's what I say. It is just, the doctor is just giving you a tool. You have to follow the right diet. You have to change your mindset and your relationship. I've had to do it many, many years and I practice it. And even now I still want to come for the physiotherapy session because it is possible for me to go back again.
You have to watch.
All here.
Most important, you have to watch what you are eating and how much calories you are spending per day.
So we'll ask the doctor, we'll ask Daktari about how the process of weight loss happens, how after the surgery, how does it go?
As I said, it has a psychological component and it has the result of the surgery. There is no miracle. After surgery, you are not getting up from the table 20 kilos less. It's not happening. Because we are working not on those plastic things and removal excessive amount of fat physically from the body. We are working on the process of the metabolism, which takes some time. But the patient is psychologically tuned that when they are not eating, it's not a problem. Because a lot of people are asking, what about the food? When you operated this patient, the patient is not so, what about the food? They go on a, first of all, liquid diet without meal, then they are getting some calories. So it's already the daily requirement is much higher than that what you are consuming. And once you are consuming less than you require, your body will give out the fat which is in your storage place as an energy device, and it will be spent. So within a week, because the speed of the losing the weight is 1 to 1.5 kilograms per week. That is a healthy weight. So within a week after surgery, you weigh yourself and you see I'm 4 kilos less. That one immediately inspiring somebody who is who was not able to lose the weight months and years.
For many years, yeah.
So it's the way how it works. So we are watching it and we see if somebody is losing too much, we are saying, come on, you are taking very little calories. Increase the amount of calories, because the speed of losing 6 kilograms per month, which is the best healthy way of losing weight. But that is how people are realizing. They just step on the weighing scale. They just check their waist circumference. It was 130. Abruptly, it is 128. Nothing changed, but the waist circumference is 128 instead of 130. 2 centimeters gone within a week. Oh,
that's very big. That's a lot.
That is already a very good reason to celebrate.
And obviously, you actually, if before the bypass, I would eat maybe a big portion. After that, I don't eat I don't eat that much. Like from my experience, I tend to feel full faster than than before. Yeah. So it's all psychological plus the tool he has given, the doctor has put in you. So it works together. Yeah. And once you see yourself losing weight, you won't go back to those bad eating habits. You actually are encouraged to do the right thing. What is the... Have you ever seen patients who have lost or managed to maintain their weight for like 10 years and then go back again? Is there a cut-off period where you'll be like, if you survive this kind of many kind of years, you're fine, you're safe? I'm asking for myself also. Yes.
The weight loss, if you are maintaining your weight loss for the 3 years, the statistic is saying the risk of gaining weight later is much less.
Okay.
Because you already worked out your routine. If we are talking about women, how many dishes you are using in your house? How many dishes you are cooking? Maybe 10, maybe 20, and it is throughout the year. You are not doing varieties like in a very expensive restaurants, 100 dishes on the menu or so. So within that dishes, you already know your portions, your ingredients, your way of eating. So if you are doing just your routine, you are not going to gain weight. Why? There is no reason for it. If you are put in the situation, you are here in Kenya when everything is available, abruptly you go to Somalia, in Mogadishu to do some work, and there is no vegetables and it is only animals and there is animal fat and you are eating that. And you changed your routine, and that routine is highly caloric. Definitely you will start gaining weight. So it depends on that. What is your routine? And of course, as I mentioned in the beginning, chronic diseases are the diseases which are requiring the patient's memory throughout. For example, you are taking your blood pressure tablets. With the blood pressure tablets, everything is controlled. You kind of recovered because your blood pressure is 120/70. Fine. But you've not taken, you've forgotten, or you did not get it in the shop or some other reasons, you've not taken the blood pressure tablets for 1 day. Okay, for 2 days. You check your blood pressure 140 over 100. Regardless how many years you were taking your blood pressure tablets, once you stop them, you have the blood pressure boom, raising up. The same with obesity, it's the same chronic disease. You don't forget about it, you are okay. You've forgotten about it and you start changing your lifestyle from healthy to not healthy, you gain the weight.
Okay, people, there's no magic. So you see, it's a lifestyle. It's actually changing your lifestyle. Whatever the doctor is saying is exactly what happens to me. You know, there's nothing I do not eat. I'm just aware. If I go for a birthday and I see cake, I will not eat a whole slice of cake because I just imagine the amount of fat and sugar. So what I'll do, I'll take a small piece and I'm satisfied.
And keep it in the mouth.
Yes.
And make the feeling of the stomach, of the mouth and tongue to feel that. And then before taking the next spoon, you'll say, I think that's enough. Thank you. I've satisfied my craving.
Thank you very much. If I know that tonight I'm going for dinner and I'll be in a restaurant and maybe I've decided I'll have steak and maybe I know I'll have a glass of wine, which is still calories, I will watch what I've eaten for breakfast and lunch so that I know I have enough. I can now, I won't overdo it. You know, if I travel and I know I ate badly and I come back, I exercise and I watch my. So it's like he's saying, you have to maintain it for the rest of your life. Otherwise, you come back to him again and make him more richer, which he doesn't mind. I'm joking. Thank you, Dr.
I wish the doctors will become rich. The problem is that they say that all over the world is very well known. Doctors cannot become rich. If you want to become rich, be a banker, be a gambler.
Pick another profession.
Change the profession. When the doctor, you are rich with that, what the people are wishing you to be rich with.
Yes, and also it's a calling.
The way of satisfaction. It's the style of life. Is that what people, those ones who are really doctors, they do it enjoying. Of course, you want to be wealthy enough to satisfy all your rest needs. And what is your need? To have house to sleep, to have enough food, to have your children educated, to be able to travel. Very, very basic things.
So it's passion.
You are okay with that? It's more passion than anything else.
It's passion. You see, it's passion.
It's more art than any technical thing. You can know how to do that technically, the operation. And you can teach even gorilla how to do the operation, but is that going to work? It has to be in your blood. That's why not everybody is a doctor. And that's why it's very expensive and very timely to become a doctor. You should study. I'm I'm still studying. I will not tell how old are you. I'm still studying.
And learning new things and new techniques. I think I should have been a bariatric surgeon. I'm just joking. Anyway, guys, thank you for watching, and we'll keep doing another series. We'll have another series after this. Until next time.